So Stephanie Stepp, who is listed on here, is the PI of this study. I would definitely like to review it for. Okay, great. So the overall goal of this project is to use innovative tools to enhance capacity to effectively manage depressed and suicidal youth in pediatric clinics. And this is expanded beyond that since this presentation was put together to community mental health settings, to emergency departments, and so forth. And BRITEPath itself is a transdiagnostic intervention for youth at risk for depression or suicide. So it's definitely, youth don't have to necessarily, meet criteria for major depressive disorder, for example, or have suicidal ideation or behavior, but it's really based on your clinical estimate that they potentially would benefit from this intervention because they are, potentially showing signs of symptoms that could relate to future risk for depression or suicide, or even, sometimes there's, people with, youth with anxiety disorders or other, factors that you just think some, tools around distress tolerance and emotion regulation would be helpful. So BRITEPath has 3 components. So there's the Bright app, which will be for the youth, and that is a smartphone app on both Android and iOS platforms. Then there's also the Guide to Bright. That's basically like an electronic treatment manual for the provider. So in a little bit, I'll actually log onto the website and kind of show you this and walk you through it. But effectively in kind of 5 steps, it leads the clinician on how to actually load content, the initial kind of content onto the app for the youth. And a lot of that focuses on building a safety plan, but there's some other kind of personalization within that too, on reasons for living and some other things, so that when they open the app, they actually have some content that's individually meaningful for them. And then there's Brightboard, which lives on the same website as this Guide to Bright, the electronic treatment manual that I mentioned. And essentially that is helping to track treatment progress over time. So you can learn about how adolescents are actually using the app. So for example, there are daily distress ratings in the app. You can see what those are on the website and also what kind of skills they were using. There's also some measures that are deployed through the website, and you can see the results of them all in this kind of like one website. It's kind of where all of the info is. And feel free, I know it's on Zoom and sometimes it's weird to cut in. So if you want to use the chat feature, if you have questions, feel free, but I also don't mind if people just unmute themselves and, say things as well. So in terms of eligibility, BRITEPath is currently used for anyone who is within the ages of 12 to 26. And again, this is really based on your clinical judgment of who would benefit from this intervention. So if there's, if you feel like there's a 12-year-old who would benefit from this, that's wonderful. If you feel like some other 12-year-olds might be a little bit less developmentally, mature, and maybe they might benefit a little bit less, it's your kind of decision on who you think would use, a smartphone app that really involves self-management of their mental health effectively. This would be a youth who is referred for mental or behavioral health care services or currently receiving services. So they're kind of like either new being referred or already receiving services. They should have some kind of mood or behavioral problem that you think would be meaningful for an intervention like this. They do have to be English speaking. The app right now and all the intervention content is primarily in English. We do have one pamphlet for parents that is translated into Spanish. And that is something that, we've learned that there are some families certainly where the parent primarily speaks Spanish, but the child is definitely fluent in speaking English. So we do have, options to enroll in that situation, although the parent does still have to provide consent in English. So, there are those kind of language limitations. All participants also have to be able to independently complete questions and the intervention. They also have to own or have access to a smartphone. It can also be a tablet if they're using that on a regular basis, but they should have some kind of device where, if we are talking about primarily an app-based intervention, they can access an app on a regular basis. For youth who are between ages 12 to 17, there has to be a parent or guardian who is able to provide consent. If they are over 18, there's no parental involvement necessary. Certainly those young adults can decide to involve a parent, tell them about the app and seek support and so forth, but there's no, direct involvement as part of that. So just taking a little pause right now, when you think about, youth who might be eligible, does anyone have any ideas of potential, client who you think might benefit from intervention like this that you can give an example of?
No, certainly there's a lot of people who could, benefit from the use of this app in terms of monitoring their mood and sort of reviewing with them skills building, strategies or coping skills and strategies. So they are certainly a useful tool. I think a lot of our teens are pretty computer and telephone, internet savvy. Mm-hmm. It's us old folks that, probably.
Yeah. Anyone else have any thoughts or ideas toward if you think of any, clients that you have that you think might be a good fit?
Yeah, this is Melissa. I have one actually, Brian. I know you're on here, and we have a couple mutual patients that I have in mind, but one is a young teen with depression and ADHD, and definitely some family stressors and some trouble coping with that. So I could see her being able to use this effectively. She's very bright and motivated, but doesn't have a lot in the way of coping strategies.
Yeah, I think that's a great example. This is a great way, I think, to deploy, kind of a broad range of content that, can be related and helpful to coping strategies that can be useful for youth with depression, for sure. So I think that's a great example. It is great when youth are kind of self-motivated to kind of, latch on and kind of take on these self-management tasks as well. And I guess I'll just use that as an opportunity to say that sometimes doing some motivation around, enhancing motivation around use can be kind of an important aspect of this too. I know usually in most settings that has to be brief in nature, but we've definitely, run across that too. And, a key piece of that can really be kind of like personalizing it for them, but we can talk about that a little bit more later. It just kind of came to mind as you were talking. So thank you.
I've also found, I think that you're working with kids and teenagers and DBT and giving them a physical diary card, is a little more challenging, but if they have something like a diary card or a mood log on their app that they always carry around, I think that it would increase compliance with completing it.
Yes, definitely. And we have had, other youth who are receiving DBT and use this app, kind of in conjunction in the past. And because that's a more kind of intensive treatment, sometimes that can be useful because there's more, kind of times to check in. There's also skills on this app that tend to be, kind of consistent with that approach. So I think it can be really nice to kind of, as a complement to a treatment that's already really great in and of itself. Yeah. So in terms of the patient enrollment, so for identifying current patients, you can give an overview to your patients about the overall study and assess if they're interested. So certainly as part of the study, they would receive the Bright app and they would kind of go through this onboarding process with a clinician and kind of following that, if they are potentially interested, they would complete, sorry. I want to make sure that I have this right, Megan. The plan for them.
This kind of changes from place to place, but yeah, I'll give you a script, tell your client about the study, see if they're interested. Again, if they're under 18, they'll need a parent to also agree. So what you guys would do then, once you identify someone, you'll send an email to this etudes@upmc.edu account, just with the patient's name, their parent's name, and a good contact for them, so that our team can get in touch, and we'll be doing the informed consent process. And then after that, I think we have another screen. It'll show you that once they consent to be in it, go next. You guys will be set up to get automatic emails that'll have your client's name in here. And then this is the information you're going to need for the Bright portal to log in and get their app set up with them. I believe you guys are going to be doing the whole safety planning in conjunction with your patients, correct?
Yeah. And I would just mention, like, in terms of assessing their interest in the study portion of it. So for them, for the families, we are doing follow-up assessments after that. So I believe it's for a total of 12 weeks. That's right, Megan.
Yeah, it's over the span of 12 weeks. There are 2 follow-up calls after the initial call. And they do get compensated for each of those phone calls.
Mm-hmm. Megan, quick question. So the first session is really just to gauge their interest, see if they're interested. And then we send the email, to you guys. So essentially the real planning of it and getting into the app wouldn't technically happen until their next visit with us.
Yeah, really, it'll just be like 10 minutes or so telling, the patient about the app and seeing if they would want to do it. And then we take care of it. And then you'll know whether they fully consented and are going to be onboarded or not. Yeah, so your second session will really be the bulk of getting the app set up for them.
Perfect, thank you.
Mm-hmm. Okay. And I will be sending an email out after this training, kind of with all of this information summed up in the scripts for you, and what kind of contact information we need sent to the email.
Thank you, Megan.
Sure.
Okay, so once you get to that second session and you are actually at this point are onboarding the adolescent to the Bright app, you would go to the, when you, Megan will send you out the link for your specific portal where you'll go on to log in, and where you can create patients or participants is the word that we would use for research study, and start the process of the guide to Bright. Essentially, once you log into there, you will click on the participants tab. And from there, this is essentially what it would look like. So you would find the user ID that was in that email, that last, that screen that was shown. You would find the correct user ID from that email. And from there, there's a couple of things. The one is that you want to make sure that the participant has both the ID and the password so they can log into their app. So essentially, like what our center will do after they complete the consent process is they'll help them to find the app on the App Store and download it. But the time that when they download it, they can't actually access any of the content until you provide them that ID and that password, until after you really completed the process of onboarding them to the app. And essentially, we want to make sure that they're using that in conjunction, with a clinician, that they're not just having all this content, not knowing what it is, and so forth. So it's important that they get this kind of at that meeting in which you're going over everything. But essentially, that's the 2 pieces. The UID is just the ID, and the plain password is the password that they'll need to get into the app. I will mention, in addition to that, they have to put in a 4-digit PIN code, and that's just anything that they want to create. So you will click to activate the user, and when you do that, it automatically pops up with the guide to Bright. And this is when I mentioned it automatically pops up with the guide to Bright, this is what it's going to look like. So essentially, you'll follow the steps on the screen, which I'm going to go through. But for now, you'll just know that there's 5 steps. And at the end of that, step 5 is that it's going to produce some content that includes a personalized safety plan. And these are all kind of things that you can download for them. They will, of course, have their safety plan on their app, but we also find it's helpful to have kind of like a PDF version of it, just as a backup if they don't have the app, or maybe that's just something that you want to upload into the medical record, just that PDF of their safety plan, that's an option too. It also prints out a PDF of the 5 steps that you just went through if you want that for documentation for your records. And then there's also a pamphlet of just, what is a safety plan? What is the BRITEPath study? That's kind of an easy thing to download and give to families if that's something that you want to do. Yeah. So in terms of getting started with the app, usually the first time we would start off with a self-assessment for, to check in to see how they're doing essentially at that first appointment. So there's a way that you can launch for them to do a self-assessment at a time that you want them to do that from the portal. So it doesn't automatically send it. They're not going to be getting them at 3 a.m. It's only when you say, I want to send this right now, and for them to receive that on the app. And that's when they'll send it. And it expires after 24 hours. So that way it really, prevents the, I'm getting a self-assessment back at, 3 a.m. kind of thing. So this is essentially how the adolescent would access that on their app. There's a little about me section, and they'll be able to see it there. And they'll get a note that it's completed at the end. And it says, thank you for completing the survey. Once they get that on the portal, you will be able to see the results essentially of the self-assessments they completed. There are 4 of them. It's a little bit hard to see here, but 4 of them. One is the PHQ, the Patient Health Questionnaire assessment for depression. There's a 5-item SCARED assessment for anxiety. There's the CAT-SS, which is a suicide risk screen. And then there's also one about treatment satisfaction. They're all fairly brief in nature, and it gives you kind of like green, yellow, and red. Green is low level of risk. Yellow is moderate level of risk, and red is higher level of risk. Also included in the portal, you'll see there's a section for daily doses, which they'll be asked to do a daily distress rating. And from that daily distress rating, it directs them to kind of different kind of activities they can do. So if you're at a high level of distress, it might direct them, for example, to consider the reasons to live or to reach out to a crisis contact. And for lower level of distress, it might be something like suggestion to exercise, get up and move, just as an example. So on the portal, you can see their distress ratings and also which activities they use following that and how that impacted their distress after that. Ideally, it reduced distress. You'll be able to see that under the daily dose tab. And there's also a completed activities tab that shows you the activities were completed and distress ratings by each user ID. And it's been edited now, so you can see it also including the patient's name to make it a little bit easier to see. There's also an area where you can just see content that they've added. So I mentioned that a really important piece of this intervention is that they can really add their own personal resources. So they can add their own photos, their own videos, their own websites, whatever is kind of individually meaningful for them. So for example, in the reasons to live area, they can add, rather than just, putting mom down, they can add a photo of mom. And so here you can just, under the added content area, you can see anything that they have added. It's an idea that they're actually meaningfully using this app. And then the last tab is the self-assessment tab that we talked about a little bit earlier. You can launch this at any point that you like. Ideally, you would use this at any point that you would regularly be collecting assessments to track treatment progress. And we've now added a nice little graphic so you can kind of see kind of a chart of these symptom rating scales over time. And then, so essentially, after that first session in which you onboard them, this slide is kind of covering what happens after that. It is ideal when possible to talk with youth about their use of the Bright app and their experiences with it over time. And I think for some of the clinicians within our clinic, their approach to it has been to have it as a standing agenda item. It's not necessarily something that's taking up the entire session, but just something to check in. Are you using that? How is it going? Are there any specific resources that you've used on that? Have there been any kind of things that haven't worked so well, things that have, or maybe there's something that's already kind of being covered during therapy that is, included in the app, like there's already a resource for that. Finding ways to kind of meaningfully incorporate that can be useful for also improving motivation to use that. Some other things about motivation, problem solving any barriers to use. use. There are simple things like I forget to use it. There's a spot in the app that they can set reminders to send notifications at times that are useful to them. Like I have time to use this when I'm on the bus to school in the morning, or whatever it is. They can put in times that are meaningful for them. That can be a simple thing. They have concerns about confidentiality. I would note just that there's like a PIN code so that no one can get into it unless they have that information. It pops up as Bright on their phone, and that was kind of purposely because it's kind of like a non-specific name. It's not like suicide prevention app or anything like that. That kind of will let other people who happen to see their phone know what that was. And another piece is identifying ways that they can enhance personalization of the app. If it's something that they're saying, this just doesn't feel like it's for me, if they put their own content on there, sometimes that can be a way of addressing that barrier. Other things that can be involved over time are monitoring the symptoms via the self-assessment area of the portal. We generally recommend doing that at the beginning of every session, but of course it's what fits within your workflow and what you can do too. And essentially whenever you do them, ideally review the results. And then you can link symptoms to Bright app use as well to understand, is the app actually working, or certain pieces working and certain ones not, because of course every skill and activity is not going to work for every youth. There's going to be individual differences and preferences. And then in terms of ongoing contact with our study team, ARC is the Assessment Research Center, and they're the ones who are conducting both the consent process, and they're also doing the assessments for 12 weeks. So they will be, they'll directly contact the family and do that, but you can just know that that's happening. They will contact you if during one of those assessments that the patient reports suicidal thoughts and behaviors. In some cases, maybe that's something they're already aware of, but they essentially will let you know about that. We do have a safety management plan, essentially, that they would check in on their safety plan. If it's something where there's imminent risk, they would connect to crisis resources and so forth. So it's not necessarily for you to, immediately need to call them back and to intervene, but we do want to let you know kind of what they reported and what are the steps that we took were. We are available for ongoing supervision and consultation. Sometimes people have preferred to have someone kind of, for example, jump in on a first session to, for help, essentially with, I just kind of need someone there to show me what this will look like the first time, and I think I can do it after that. So if there are things like that that feel useful to you, just know that our team is happy to be available in that way. Or if there's, one specific person who wants that help that can maybe disseminate it to others, that's a model that has worked well in other sites as well.